Yeah, tuberculosis is actually a very common problem around the world. Every year, 10 million people become sick with tuberculosis, and almost 2 million die of the disease, which is really a tragedy since TB is completely treatable and completely preventable. I think the big misunderstanding that I see is that people think TB is a disease of the past, or it's a disease that only happens to other people. But what people should understand is that anyone who breathes can become sick with TB. We have in our hands the tools to completely wipe TB off the earth. It's just that we lack the funding and partnerships to do so. So Village Healthworks does a number of really important things that are unique and impactful when it comes to fighting diseases like tuberculosis. Really, the strongest thing that Village Healthworks does is it approaches things from a community level through true partnership with community. And we know diseases like TB that are really stigmatized and impact communities are often some of the hardest to take care of if you don't have a community-based approach. But the other thing that Village Healthworks does is they provide comprehensive services across the spectrum of care. They're not just in the community, but they tie the community to an excellent outpatient center and inpatient center so that people who are found to be sick and suffering from TB can be offered the best care. For example, I just saw a mom and her 4-year-old child, and this child is at very high risk, we think has TB. He was found in the community and was brought into care here, where he was able to see an excellent team of physicians who have made a clinical diagnosis and started him on treatment. And this is the kind of care that's really lacking in many places, especially for children. So what Village Healthworks does is it offers the full range of services from the community all the way to the hospital level. And that's very unique. And it's one of the reasons why I think we have hope in a place like Kigutu, Burundi, for actually addressing and ending TB. Absolutely. There is a lot that we need in terms of partnership to really make a difference in ending tuberculosis. The sad and heartbreaking thing for me, and I've been a tuberculosis doctor for 30 years, is that TB is a disease that's completely preventable and completely treatable, yet millions of people die from it every single year. And part of that is because we lack the support and the partnerships that we need to truly address TB at all levels. Right now, the global health funding crisis has made a TB crisis as well, and we're estimating that because of the cuts that have been made to global health, millions more people will die unnecessarily of TB in the next 5 years. So what we need are people to step forward and fill that void and become active partners with groups like Village Healthworks, who are also trying to step in and fill a gap when it comes to dignified personal TB care. So we really need people who are as committed to making sure that nobody in this world dies of a treatable infectious disease. And now more than ever, we need partnerships and really active partners at all levels.